So I'm Dr. Namrata Agrawal, critical care specialist at Borivali Healthcare. So we will be discussing about organ failure in an ICU. So organ failure sounds scary, and it is scary, but if caught early, it can be a reversible phenomenon. So we will break it down, what is organ failure and how do we treat it. So organ failure means one or more of your vital organs in the body are not functioning normally or are functioning at a lesser capacity to keep your body functioning or sometimes even to keep you alive. So the organs like brain, heart, lungs, kidney, liver, they may fail at some point and they may require an intervention to either recover them or to replace them. So some of the organs that might fail are heart, it may go into heart failure, lungs, it may go into respiratory failure, liver, may go into liver failure, kidney may go into kidney failure, and brain, it can go into coma or brain death. So some of these failures are reversible and some are irreversible. So whenever an organ fails, we need an intervention in the form of some equipments or some machines, or we may have to go for transplant as well. So whenever a liver fails, it can gradually recover on its own and we need to support the organ, or sometimes there is a special form of dialysis which is called MARS, and we may have to temporarily support the liver by doing this dialysis. This liver dialysis, if it doesn't improve with that, then we may have to go for liver transplant. Same with kidney. The kidney damage is generally reversible if it is caught early and if it has not progressed very rapidly. If it has progressed very rapidly, then you may have to go for kidney transplant at some point of life. And for temporarily, we may have to support it with the dialysis. Brain death is irreversible. You cannot reverse this. Coma, comatose patient may come out given what is the disease which has caused the coma. Respiratory failure, again, it may require oxygen support, sometimes ventilator support, and sometimes lung transplant as well. Heart also can be managed with the medications or using a device known as left ventricular assist device, LVAD, or Impella, and they can be managed. They may also require transplant if it is too advanced. So some of the conditions which can give rise to organ failures are infections in the body, some autoimmune diseases, chronic diseases like diabetes and blood pressure, some toxins, ingestion of some poisonous substances, and during trauma or blood loss if the body organs have been damaged. So each organ have its own warning signs. There are some red flags that you need to observe and consult your doctor immediately, like there is sudden onset of confusion or altered mental status, drowsiness, there is excessive bleeding from your nose or in your stool, or sometimes blood in the vomit. There may be difficulty in breathing, low urine, yellow color discoloration of the skin, dark colored urine or black colored urine, chest pain or extreme fatigue. So these are some of the signs or symptoms that you may experience, and whenever you experience these symptoms, you have to consult your doctor immediately. What is the role of an intensivist in this organ failure? So we intensivist recognize that the organ is failing and we initiate the treatment for that failing organ in the form of dialysis, in the form of any machinery, ventilation that is needed. We then go to the root cause of why that organ is failing and starting the treatment for that. We prevent the further damage of that organs by halting the disease process or decreasing the speed of the disease, and we plan for transplant if at all that is required. So now what can you do? So prevention is always powerful. You can lower your risk by getting regular checkups with your doctor, keeping your disease in check, your diabetes, blood pressure controlled, keeping yourself hydrated, avoiding obesity, eating healthy diet, avoiding self-medications in any form of illness. So these are the steps that you can take to prevent your organs from failing. So organ failure is serious, but it is not completely final. Your organ failure can be prevented if you seek help early in the stages, and with advanced ICU and good ICU support, you can come out of that organ failure as well. Thank you.